I'm Lorna Warwick, and I'm pleased to present our abstract on variances in patient-reported experiences with shared decision-making by biological sex in patients with diffuse large B-cell lymphoma, an analysis from the Lymphoma Coalition's 2024 Global Patient Survey on Lymphomas and CLL. The aim of this study was to look more in depth at shared decision making, which we think is a key element of patient-centered care. And of course, that involves more than just asking a patient what treatment they would like, but also an understanding from the healthcare provider of the patient's goals of treatments, as well as their lifestyle and any other factors that may influence what they are willing to tolerate or not. Previous research has shown that there are differences in patient-reported outcomes by biological sex, but we haven't found a lot of evidence if there's similar outcomes on patient involvement in care decisions. So we decided to investigate this, specifically looking at patients with diffuse large B-cell. The survey itself is a cross-sectional, anonymous, global online survey. We do this survey every 2 years. The data for this study came from the 2024 version of this survey. We only looked at people with lived experience of DLBCL, and there were 1,100 respondents, primarily female, with a median age of 58, with a range of 22 to 92 years. Questions that we examined covered treatment preferences, including whether or not patients were given more than one treatment option, their involvement in decisions about their care now and what they would like it to look like, as well as communication with their healthcare providers, which can influence not only how much they participate in those decisions, but the information that they have available to help them participate and make those kinds of decisions. The responses that were then categorized by biological sex and analyzed descriptively. Overall, it's important to note that almost all patients, regardless of biological sex, said that they wanted to be involved in decisions about their care, reinforcing that shared decision-making is very important to integrate into clinic. But it was also noted that for everybody, there were gaps in how this was actually transpiring. Half of patients don't feel adequately involved in their treatment decisions. 60% say their doctor doesn't routinely check that they're understanding what's being communicated and don't always feel that their doctor encourages questions. And 45% say that their doctor interrupts them before they're fully able to articulate their thoughts. But we do know when we look at the same questions by biological sex that there are some significant differences. In the figure, the male responses are in the teal blue and the female responses are in the purple color. And you can see right across the board, males are more likely to report a positive experience than their female counterparts from being provided a treatment option up front, even though that's low for both, right through clinic behaviors and how involved they feel in decisions. We also asked patients about the method of decision making they would like to happen, how much they want to participate and who they want involved. While half of patients say that they would like shared decision making involving their doctor, some with and some without their care partner. It's important to note that a quarter of patients who are female said that they prefer to make their own healthcare decisions, where 27% of males said that they would prefer their doctor to make the final decision for them. So in conclusion, we just like to stress that shared decision making is vital. It is what patients want and expect. There are gaps for everybody, and there are some things that need to be rectified in clinic, but there are differences between male and females that should be noted, just so that we perhaps can rethink how we're talking to our patients in the clinic and make some different choices, and also maybe check in with your patient, see what kind of decision-making process they would like to go through, how involved they would like to be in these decisions, and then checking to make sure that they are feeling included to the degree that they would like. So there are gaps for everybody, so this is an area for improvement. If you would like to learn more about our survey and the Lymphoma Coalition in general, you can do so at this QR code. Thank you.